Hello all, this is Mrs.Lalithamani, Associate Professor from SNS College of Nursing. In this lecture series, we will be learning about the topic which is very commonly happening one, that is comes under the subject Adult Health Nursing 1, and it is the fracture. The problem is with the orthopedic conditions. So we will learn about what fracture is and its consequences. So while talking about a fracture, you might have seen somebody telling that I had a fall and there is a break in the bone continuity. So there is a pain and I am asked to take rest. There is a POP. A mild fall from a two-wheeler or from a small height caused a fracture in the bone. It is a very commonly heard diagnosis where a small slip or in any pathological conditions will result in fracture. A fracture is a break in the continuity of the bone. So a fracture is a break in any bone in any part of the body. So to understand that it is a fracture is a break in the continuity of the bone. So it can happen in any part of the body, any part of the bone. So there are more types of fracture. One is the normal one, a bone. The normal bone when it is without any disruptions in the continuity, that is called as normal bone. When there is a disruptions or break in the continuity, it is called as fracture. So when you see the screen, you can see the different pictures showing the difference in the size and shape of the bone. So the first one is transverse fracture, where there is a long cross-sectional cut. The bone has broken into two pieces with a longitudinal or in between. And an oblique, as you hear the name, it is oblique, it is a slight slanting. It is like a slanting line where the fracture has happened and they made the bone into two pieces. And next one is spiral, where it is like the entire body, entire bone will be broken in a cylindrical or spherical manner. Next one is comminuted, where the bones are crushed. Avulsion fracture, impacted fracture, fissure, and greenfield. So the avulsion is that is the two parts of the body bone has gone into two different areas. Impacted is that is a compression fracture, and the fissure is where the problem is with a vertical line is happening over there, and that greenfield fracture. Then greenstick fracture, there is a half of the bone part is being struck and the remaining is not with the problem. The next one is the causes. When we see the causes, one thing is it might be due to the direct blow, crushing forces, sudden twisting motion, and extreme muscle contractions. So these four may be the major reason for the fracture, and this includes a fall or a sports injury, or most probably it will happen with the sports injury. A person when they are falling down on the twisted motion, or it is a crushing injury or something, the pressure is being held on that particular bone, the fracture might be resulting in. So when we understand this, we need to find out that what is the definition of each fracture. A complete fracture and incomplete fracture, we can call it as. The complete fracture is a break across the entire cross section of the bone is called as complete fracture, and an incomplete fracture, the break occurs through only part or the cross section of the bone. In the image you can clearly see the first picture tells it is a complete fracture and the second picture tells it is an incomplete fracture. So where the cross section of the bone is not complete and it is complete. The first one it is complete and the second one it is not in a complete form. So the types of fracture, it might be also a incomplete fracture and incomplete fracture. So we'll see the next topic on how the things happen in case of closed fracture and open fracture. When we talk about the types of fracture, we have seen many kinds of oblique, comminuted, spiral, greenstick. Also in that we will be learning about how the open fracture, complete fracture and incomplete fracture. Here we call it as another category, the closed fracture and open fracture. Closed fracture is also called a simple fracture, and where the skin is not broken down, and in closed fracture the skin is not broken down, and in open fracture the skin is opened down and exposed, the mucous membranes are exposed. So next one is the open fractures, how it is being graded. The grade 1 is a clean wound less than 1 centimeter long And grade 2, it is a larger wound without extensive soft tissue damage. But when it is grade 3, it is highly contaminated and has extensive soft tissue damage, and the image is clearly depicted in the with the grades. And coming on to the types of fracture, so as we have seen, it is might be an open fracture, closed fracture, complete fracture and incomplete fracture. Here you can see it is an open fracture, complete fracture, and this happens in the one single bone fracture. So until now we have seen about what are the types of, what is the definition of fracture, what are the types of fracture, causes, and we have discussed each and every type, that is open, closed, simple and complex compound fractures.